Leeds Community Healthcare NHS Trust, or LCH for short, provides a range of community healthcare services to the people of Leeds and beyond. Care is always provided in or as near to a person's home as possible. We provide 56 services organised into 3 groups: adult services, specialist services and children's services. On average, LCH delivers care to approximately 5,000 people every day. That's 30,000 people a week. Last year, we delivered care to over 1.5 million people. Meet the Loyner family, who live in Leeds. Here's Kay and Steve, or Mum and Dad, their daughter Lucy, who is 17, and son Felix, who is nearly 11, Bert the dog, and Grandma Betty, who lives across the park.
Hi, I'm Kay. I'm expecting another baby boy. Next week I've got my first home visit from a 0 to 19 specialist public health nurse. I've got lots of questions as it was nearly 11 years ago when I had Felix. I'll get my red book too, where information about our baby will be recorded. After the baby is born, they'll visit us a few times at home and I'll be able to chat about anything I'm worried about. This year, Felix is moving up to high school and Lucy's going away to university. They've both had support from the 0 to 19 team over the past few years. I'm worried about Lucy moving to university, and I think she is too, but I'm sure she'll be fine with the right support.
When I was in high school, I was really slim. I felt down a lot. I struggled with sleeping and concentrating at school. I used to avoid eating and made myself sick after meals sometimes. Mum found me hiding food in my room and persuaded me to go to the doctors with her. I was referred to the CAMHS Community Eating Disorder Service, who were actually really patient with me. My health improved really quickly and my mood, sleep and concentration all got better as a result of my plan. When I started to put weight and I started to feel much better about myself, and the support from CAMHS was reduced gradually. Now I feel okay to speak with Mum and Dad about it as they understand more about my condition and they know how they can support me when I need it.
Hi, I'm Steve. I was diagnosed with type 2 diabetes a few months ago, but I didn't really know what it was. Lucy saw something on Facebook about a diabetes education course called the Leeds programme, and I thought I'd give it a go. It was great. I'm now much more careful about what I eat, and I am trying to do a bit more exercise. Bert helps with the second bit. Since taking part, I'm definitely less worried, and I feel much better. Me and Bert are going to walk to Mum's house now for a visit. She isn't very mobile. Before attending the course, I would definitely have driven there. Hi Mum, happy birthday!
Thanks, Pat. It's my birthday today. I'm 80. I visited my doctor last year and he was worried that I wasn't remembering to take my medication. They asked Claire, a memory specialist, to come and speak to me at home. I now get visited 3 times a day by somebody from their team. They make sure I've eaten and that I've taken my tablets. My husband Bill used to help me with these things, but he passed away 2 years ago. A nurse called Victoria and her team helped me to look after him before he died. When he left the hospital, Victoria stayed with us to ensure that he was settled and that we knew what to do if he got worse. When he passed away, they made sure he was wearing his favourite football shirt, which is something he asked for, and that meant a lot.
It's safe to say our services will reach most citizens of Leeds at some point in their life, and when they do, we want to ensure they receive the best care possible.